Next, we're going to talk about endometrial thermal ablation. What is endometrial thermal ablation? That's where you go up in the lining of the uterus and you burn the lining. And why would we do that? We do that to help minimize the amount of bleeding that a woman experiences when they have heavy vaginal bleeding. When you think about the uterus, I think of it often like the walls with wallpaper. And so if you're having your period every month from all the walls, but then you go and you strip off all the wallpaper, there might be a little bit of wallpaper in the corner that you continue to bleed from after the ablation, but approximately 80% of folks after an endometrial ablation are happy with their results and do not go on to have a hysterectomy. So what does the ablation entail? Normally, I do endometrial thermal ablations in the operating room. So I'll talk to the patient preoperatively. We'll take them back to the OR where they'll be gently put to sleep. We put you in the same position like if I were to do a pap smear in the office. I figure out how far it is from the top of the uterus to outside of the cervix. I put my device up inside the uterus. It calculates the width and the length and the amount of energy that it needs to distribute. And after about a minute and a half, it actually burns the lining. Then I go ahead and pull out the ablative device. I take a look up inside the uterus again to make sure that all of the lining got treated, and then we're all done. The procedure really does not take very long at all. Now, when you look at the handout, I use the NovaSure. There's a lot of different ablative devices that are available, and I think this one picture says 1,000 words, where when you think of the lining of your uterus, you have the outside surround wrap, that's what I always call it, or the peritoneum. You have the muscle of the uterus that is there obviously to help push the baby out when people are in labor, and then you have the light pink lining. The only part of your uterus that listens to your brain and all of the hormonal stimulation is that light pink lining. So if we burn it, then it can't listen anymore, and then you don't have your period from that area. So before there's all the light pink, and then afterwards it's all white. And so that's just kind of what those pictures entail and describes exactly what the procedure is. Another way I kind of think about it too is whenever you burn the lining of the uterus, you also do a hysteroscopy at the same time. And hysteroscopy is just where you put a little camera up through the vagina, through the cervix, and in the uterus. So I think of myself as a little caveman with a little cave light kind of crawling up there and looking around. So I think of the inside of the uterus like a balloon. It should be nice and just smooth all the way around. So when you so I'm going up through the cervix, taking a look in the uterus to make sure everything looks great. Then I burn, such as this handout shows, and then I kind of crawl out and everything's good. Women would come and speak with me about an endometrial thermal ablation if they've had irregular vaginal bleeding that is heavy in nature. And classically, the patients that I would see that desire to have an ablation are women maybe or definitely are done with childbearing, because once you have the lining of your uterus burned, you can never go on to have a baby. So definitely you have to be completed with childbearing. Also, the amount of bleeding is burdensome to your life. And so classically, those women would be in their 30s or 40s. I have several patients in their 40s who are interested not necessarily in a hysterectomy, but just in an enhanced quality of life. So those class of folks, I definitely talk about the Mirena IUD because again, that secretes that progesterone at the lining of the uterus and makes people's periods lighter and less uncomfortable. But some women are not interested in the Mirena. They would rather have the NovaSure or an endometrial thermal ablation done. So really the Mirena and the NovaSure are common conversations that I have with women all the time and kind of treat both the same symptoms in general.